In this symposium, we're going to have a look at odontogenic neoplasms and tumours. Now, this is a subject which is very close to my heart as it's one of my main clinical and research interests, so I apologise now if I get a little carried away. The aims and objectives for the lecture you can see on the slide in front of you there. And this is an area which we do expect you to be familiar with, but not in a lot of detail. As with salivary gland tumours and the odontogenic cysts, there are a large list of these lesions. So we expect you to know the more common ones, but not a lot of detail about some which are really very rare indeed. So in this first video, we're really going to just have an introduction and have a look at epidemiology of these lesions. And then we'll spend a little more time in the later videos looking at some specific lesions within these groups of neoplasms. So we go back again to the cysts lecture and we think about the tissues which give rise to teeth, and these odontogenic tissues are those which we need to pay attention to when we're thinking about odontogenic neoplasms. Now that tissue can either be epithelial or it can be mesenchymal in origin. The epithelium can come from a number of different sources. For example, it can come from the oral epithelium, which is not really very common as far as odontogenic tumours is concerned. That's obviously far more common in terms of ordinary squamous cell carcinoma, oral cancer. But the dental lamina, which we've had a look at in terms of the cysts which arise from that, the enamel organ as a whole, the reduced enamel epithelium, and the cell rests of Malassez are the epithelial remnants of the tooth-forming apparatus. And so they can give rise to a number of different lesions, including those which are truly neoplastic. There are also a number of mesenchymal connective tissues, including the dental papilla, which has become the dental pulp in a mature tooth, the dental follicle, and the periodontal ligament. Now again, we've seen this slide before in relation to the cysts, so I'm particularly wanting to talk about the dental lamina and the lesions which it gives rise to. The dental lamina, these small rests, inactive rests of odontogenic epithelium left over after the dental lamina fragments, give rise to a number of lesions, and some of them are here on the slide. Ameloblastoma, which is the tumour we're going to spend the most time on in this symposium, is the most common of these. But others, ameloblastic fibroma, the calcifying epithelial odontogenic tumour, or CEOT, and then other cysts that we've talked about in the earlier lectures. And these fragments of dental lamina, they can vary in size from just small florets of half a dozen cells or more to strands, and then other larger islands of odontogenic epithelium, as you can see in the bottom right of the picture. Now, odontogenic tumours in general present largely as radiolucencies. Some of them may contain calcifications, but for the most part, they're not forming any dental hard tissue or have any mineralization. And some of them do, and we'll talk a bit about them as we go through, but the more common ones do not. The most common site for an odontogenic tumor is at the angle of the mandible, and that is related to the fact that that is the most common site for there to be remnants of dental lamina. So therefore, it's not a surprise that odontogenic tumors most commonly arise at this site. In terms of classifying them, we do that largely onto 4 groups. 3 of them are benign and 1 is malignant. And when classifying the benign tumours, we separate them largely by their histogenesis. That is, what tissue do they arise from? And so group 1 tends to be those which have arisen from odontogenic epithelium alone. Group 2 are those which have arisen from neoplastic odontogenic epithelium and odontogenic mesenchyme. And so because you have both of these components, it is possible that you'll get true dental hard tissue formation in the group 2 lesions. And then group 3 are lesions which have arisen from odontogenic mesenchyme alone. The 4th group are those that are malignant. These are extraordinarily rare, and the malignant tumours can either be carcinomas if they've arisen from epithelium or sarcomas if they've arisen from odontogenic mesenchyme. On this slide here, we see the classification which was presented in the most recent WHO classification of tumours of the head and neck. And again, they have largely split them into the 4 groups that I indicated to you. And so there are a number of different tumours under each grouping. This, you'll be glad to know, is a little bit simpler than the last WHO classification in 2015, But where these have come from odontogenic epithelium, those which have come from a combination of odontogenic epithelium and mesenchyme, and those which are benign and have arisen from odontogenic mesenchyme alone. And then lastly, there's that list of odontogenic malignancies. Now, it is very definitely true to say that odontogenic neoplasms are rare. In comparison to neoplasms from the other tissues, for example, from the surface epithelium, be they benign or particularly malignant, odontogenic tumours are far less common than that, and in fact are less than 1% of all oral tumours. Ameloblastoma is the most common neoplasm. That is, it has an intrinsic growth potential of its own. I'm going to show you a little bit of data from the figures related to that classification in the previous slide. And you'll find that in many of the classifications that odontomes are present in these lists. Now, you may remember from earlier lectures that odontomes are not neoplasms. In fact, they are hamartomas. So they are malformations which are growing during the growth period of the patient. And then when normal growth stops, they stop growing as well. And that's not the behavior of a neoplasm. But ameloblastomas are the most common true neoplasm of the odontogenic tumours. And so this is the type of data that you might find in relation to the epidemiology. You can see at the bottom that odontomes comprise about 50% of them. We've already said that they are not truly neoplasms, they are hamartomas. And they comprise both odontogenic epithelium and mesenchyme, so that means that they are in group 2. Also because they have epithelium and mesenchyme, as you'll be aware, odontomes form dental hard tissues. Ameloblastomas of the true neoplasms are the most common, and they are odontogenic epithelium alone. And you can see the others here. Most of these, which are in the list here, we will spend at least a little bit of time talking about in the later videos.